So today we have Santina Busch Russell. She is a current student within the graduate program for LMU. So she is one of my students. She is also one of my previous students at King University, where she graduated in 2015 with her Bachelor of Science in Criminal Justice. Santina Busch is, and it's blowing me with the last name. I'm sorry. I keep thinking, I've always thought of her as just Santina Busch. Ms. Russell is the East Tennessee Substance Misuse Program Director with the Tennessee Department of Health. She grew up in Baltimore, Maryland, and moved to Tennessee in 2011. She attended King University, as I said, for her undergraduate and is currently working here at LMU on her master's degree. Santina previously worked with the McNabb Center's HIV Prevention Department, providing education, prevention, rapid testing, and wraparound services to clients in need. She is currently Vice President on the Board of Directors for the Next Step Initiative, a nonprofit focusing on harm reduction, reducing homelessness, and HIV and HCV testing in Knoxville, Tennessee. Santina also serves as an ambassador for the CDC, representing the East Tennessee region with the Let's Stop HIV Together campaign. Today, she is presenting on substance abuse in the criminal justice system and HIV criminalization. So, Santina, welcome, and I give the floor to you. And let me say before we start, all questions, please post them in the Q&A below, or you may post them in the chat, and I will address all of those and read those out when Santina is finished with her presentation.
Thank you, Dr. Black, for my intro. Can you guys hear me and see me okay? Can you guys see the presentation on the screen too?
Yes.
Okay, perfect. So as Dr. Black mentioned, I'm Santina Busch Russell. I can't say my name right either. I just recently got married, so give Dr. Black some grace on that. I am the last presenter today and for the whole event, so I promise I will try my best to make this as harmless and fun as I can. And hopefully you guys will, these are topics that a lot of people know about, and I'm hoping that within the information I give you today, you guys will learn something new. So before I begin though, I did want to mention that the topics that I am going to be talking about can be controversial. So I wanted to say that I'm not here to push any political agenda or pick any side, but I'm here to provide you all with the research and to educate you on what our health departments are doing. So let's go ahead and start talking about this fun stuff. So before I begin, with the meat of the presentation, I want to tell you what our East Tennessee Regional Office does. So I am as Dr. Black also mentioned, one of the East Tennessee Substance Misuse Program Directors or Coordinators. I also have a coworker who works closely with me, another director named Kaylee Clark. She's on here. She'll probably be active in the chat. We are housed at the East Tennessee Regional Health Office next to UT Medical Center in Knoxville. So about us, so we are one of 13 regions under the Tennessee Department of Health. So as you can see, Knox and East Tennessee is here in blue. And then for those of you that are across the state, you can kind of see what's in your region. And we've got 6 metros. So number 3 here is Knox County. And here with the East Tennessee Regional Office, the rural health departments are a little bit different than our metros. We've got 15 mostly rural counties, as you can see here also. And we've got a population of about 700,000. So when I was in new employee orientation here, one of our directors has mentioned that somebody is going to come to you and one day say, what is our mission statement? So you need to memorize it. So this is it. It's to protect, promote, and improve the health and prosperity of people in Tennessee. These are some of our services that we provide here. Some of them you all may be familiar with. I know a lot of people are familiar with WIC. We also, interestingly enough, a lot of people don't know that we have 4 primary care clinics and sites, and those are in Anderson County, Blount County, Roane County, and Sevier County. We also have 5 dental sites, which are in Blount, Campbell, Hamblin, and Loudoun and Roane. So let me look here and see. We provide dental for kids under 21 with TennCare, and with no insurance. So we also have a breast and cervical program where we have grant programs that help cover testing and treatment for men and women needing that service. So the reason why you see communicable disease here, so we are going to be talking about HIV, and I wanted to bring this slide to your attention because a lot of people do not know that here at the health departments, we have in each county something called disease intervention specialists. And what these specialists do is they conduct investigations and follow up with individuals who test positive for any of these above. So if someone tests positive for HIV, syphilis, chlamydia, or gonorrhea, we will call you and follow up with you to make sure that you get into treatment. The thing that most people aren't aware of is that if we cannot reach you, we are going to try every method to reach you. So we will show up at your door, we will call you, and we will also send letters. From my experience in the field, a lot of people did not know that, and they were very offended and surprised as to why we were showing up at their door. So I wanted to let you guys know about that. And of course, if somebody tests positive or somebody, excuse me, tests negative, then of course we're going to provide prevention counseling for that. Okay, so on to the meaty stuff that y'all signed up for, I guess, came here to listen to me talk about today. So as the substance program director, misuse program director, these are the projects that me and Kaylee are currently working on in collaboration with Knox County Health Department. So a little background about this. So the CDC awarded TDH. TDH is the Tennessee Department of Health. You'll hear me say TDH quite a bit. They awarded a grant to us to fight the opioid drug overdose epidemic in high impact areas. So these high impact areas are Cott County, Jefferson County, Knox, Roane, and Sevier County. So the grant that we got awarded was called HIA, aka High Impact Area Grant. So I'm kind of going to briefly talk about these 7 projects with you. So with the acute opioid overdose response plan, so what Kaylee and I do is we have a plan in place here, and Knox County Health Department does as well, where we can respond quickly and appropriately during overdose spikes in the community. So that's a plan that we've put into place for that. Number 2 is we are helping to establish anti-drug coalitions in all of the counties. So right now, I think we've worked with members in Cott County, we've worked with all over the region. Right now, we're working with trying to get something established in Granger County. Our MAT pilot program, which is medication assisted treatment. And if you guys have seen me comment on any of the other speakers this week, a lot of my questions were geared to MAT because it is what we do. So this pilot program I'm going to discuss here in shortly in the next few slides, but for those of you around Jefferson County or criminal justice professionals, you guys may already be aware of Judge Dwayne Sloan. But his team is assisting people who use drugs involved in the criminal justice system to obtain MAT and other services. So he is phenomenal. Kaylee and I meet with him. We go to recovery drug meetings, and he is awesome. He bought us pizza, and he is just a champion and has actually won national awards for his program. So we are looking forward to continue working with him. Number 4, expanding syringe services programs. So SSPs. So for those of you that aren't sure what that is giving out clean syringes, clean needles. So we partner with Choice Health Network. They're in Knoxville, and we are trying to establish SSPs in counties that outside of Knox that don't have any. So right now we've got a mobile unit in Cobb County. We have one opening in Campbell County, I believe, April 8th. And we have standing ones that are in Knox County and Claiborne County, for those of you near LMU. 5, our emergency department overdose protocols. So we work together with hospital partners, and this is primarily something that Knox County Health Department is working with, but we work with hospital partners in the HIA to create overdose protocols to assist people who use drugs and their families after a non-fatal overdose. So that's what we do for that. And then linkage to care at Knox County Health Department and in the region. So that's going to be similar. So basically, we have full-time harm reduction navigators that were hired to inside the health departments that provide education, brief interventions, case management, and referrals for people who use drugs. So these people are navigators, and they are basically holding your hand throughout the process. If you're interested in getting treatment, they are going to work hard, and they're going to get you into treatment, or anybody that you know, and just kind of help you throughout that process, because as we know, that can be a very, very overwhelming and scary process as it is. So that's a little bit about our projects and what we do. As far as harm reduction navigators for the region, Kaylee and I, we handled that. So I supervise a harm reduction navigator in Roane County, and she supervises one in Sevier County. So our plan is to expand this linkage to care to every county in the East region, but that will be a little time before we can do that. So I wanted to kind of show you guys some statistics and data that I have here, and I meant to do this in the beginning, but I didn't. I wanted to thank everyone here at TDH that has helped me with statistics and data to kind of help put this together. So this is just kind of showing you, you know, breaking it down by county here. So as you can see, in the region, we had 365 drug overdose deaths in 2020. And then, let me move this, excuse me, 342 in the Knox region. So deaths for 2021 are currently being collected and verified, and we will have more information on the 2021 deaths later in the year. So this is the most recent public information that I can share with you all. As you can see, Knox County is unfortunately has the highest. Then, you know, we've got Anderson County, Blount County, and then Roane and Sevier counties, which of course I mentioned we have harm reduction navigators there for that purpose. So those are fatal overdoses, and now we're going to look at non-fatal overdoses here in the East region. So I'm going to let you guys look at that and just kind of see. I mean, it's pretty self-explanatory here that we have a big problem going on, and that's why it's really important for us to continue the work that we do. So, okay. So now I wanted to compare, you guys kind of saw non-fatal and fatal overdose deaths. This is compared across the state. So this is what fentanyl overdoses look like across the state. So as you can see, and as you've probably heard in the media, there's probably all of us in here and all around probably know somebody who has overdosed, or you know, maybe just family, friends, someone. So I know that this is a topic that hits home for everybody, but significantly these numbers have just spiked in the past 6 years. We went from 12% of deaths involving fentanyl to 66% of deaths involving fentanyl. And I know that Mr. Sam Henson had talked briefly to you all this week about fentanyl, and Lachey also talked a little bit yesterday about fentanyl. So this is kind of what we're looking at, and it's definitely, like I mentioned, a very major problem. And down below, I do want to note, and you can see it on your screen as well, that an overdose can involve multiple substances. So on my next screen here, and this is still 2020, kind of breaks it down a little more in depth for you. So 2014 of those deaths were fentanyl, 595 were pain relievers, and then, 331 were heroin overdose deaths, and then 1,315 were stimulant overdose deaths. So, and then at the bottom it says that 66% of all of these deaths involved fentanyl. Okay, so like I mentioned again, Mr. Sam Henson and our speaker yesterday, who I actually had class with, she's wonderful, kind of talk briefly about fentanyl, but I'm going to go into it in a little more depth for those of you that may not know. So obviously it is basically the driving the increases in fatal overdoses here in Tennessee. I believed I watched it was some kind of training, and it said that the most used drugs, I think in the state of Tennessee, it was methamphetamine is 1, marijuana was 2, and fentanyl was 3. So this is just Santina talking, but I would think that fentanyl will probably be close to the top here soon. So in the last screen, you saw that 2014 Tennesseans died of a drug overdose that involved fentanyl, and 2 out of 3 fatal overdoses involved fentanyl. So the thing with fentanyl is that fatal drug overdoses are increasingly likely to have multiple substances known or unknown to the user. So unfortunately, I had a friend who had never used drugs before in her life last year, who was using Xanax to help with her anxiety. And she ended up getting some Xanax, I guess ran out of prescription, and ended up getting some Xanax from someone off the street, and it was laced with fentanyl, and it killed her at 45 years old. So you think that what you're getting is heroin, you think what you're getting is methamphetamine or hydrocodone, for example, but you're truly getting fentanyl. And when most people are asked, you had fentanyl in your system, it's a big shocker to them. They had no idea that it was even in there. They say, I thought I was doing heroin. So about 1 out of 3 fatal overdoses in 2020 involved an opioid and a stimulant. So in my abstract, I did mention methamphetamine to you. We're not going to talk about it in depth, but I did want to mention how this ties in here, that methamphetamine is a popular drug used here in Tennessee, so especially in the East region. I'm sure everybody's heard of those meth labs and things of that nature. I'm from Baltimore, as you guys heard, and it's actually considered like the heroin capital. So when I moved here to Tennessee, I learned so much about meth. I had not even heard meth before. That just goes to show how widely and consistently it's used. Since 2020, though, methamphetamine has become the most submitted drug at the Tennessee Bureau of Investigation over marijuana. And the TBI, according to them, research says that they believe that the rise in methamphetamine use could be linked to the opioid epidemic because people are turning towards stimulants over depressives. And just to I was going to give you a visual, but you guys have probably seen that visual circulating around Facebook, social media, of it's got like three little containers of powder, and one's got fentanyl in it, and it's got very little in it, and it says this is a lethal dose that can kill you. So only 2 milligrams of fentanyl can be lethal, depending on a person's body size, tolerance, and past usage. So only 2 milligrams can actually kill you. It is harmful when it touches the skin. This is some serious stuff that you guys are definitely aware of. So just to kind of continue on that, so opioids are a type of chemical that binds the opioid receptors in the brain. So this includes prescriptions like morphine, codeine, hydrocodone, oxycodone, and then your street drugs like heroin. So There are two types of fentanyl. You've got your pharmaceutical medical fentanyl, which is of course used in pain relief, used with surgeries, things of that nature. And then the huge rise that we're seeing is the illicitly manufactured fentanyl. And of course, that's the illegal one. It's used for heroin-like effects and getting high. I believe it's, and I think Sam Henson mentioned this, it's 100 times stronger than morphine, more powerful. And the rise in fentanyl involved overdose death is linked with illicit fentanyl, which we've already talked about. Okay, so I wanted to give you guys, with all that talk about fentanyl and how dangerous it is, I wanted to give you guys some prevention strategies for those of you that may not be familiar with this. First, I wanted to kind of go over signs of an overdose. So signs can be, a person can be awake but unable to talk. Their body can be limp. They can have shallow or slow breathing. Their skin can be pale or clammy, and they have loss of consciousness. We always like to say that some harm reduction strategies that can help here with someone who is actively using is carry naloxone. So I'm sure you guys have heard of Narcan, aka naloxone. So carry that and have it in plain view if you or someone that you know is using. We suggest try a small amount of the dose just to check and make sure with the effect, and use with someone else and take turns. So I don't know if you guys are aware of this either, but we have, and you see it at the bottom here, there's actually a phone line that somebody who's using can call, and it's never use alone. What happens is, say for example, I would call this hotline, and an operator would answer the line, and they would ask my name, where my location is, and then they would stay on the line with me until hopefully I was finished. If during the call they didn't hear me talk and they thought I became unconscious, then they would call and alert paramedics, and they would come to the location that I told them. So that's one thing, a resource that we give out to, I personally give out to our friends that are using. So with other prevention strategies that you can see, so take medications that are only prescribed to you, gotten from a pharmacy. I explained, the unfortunate situation with a friend of mine. For those of us that are parents, I have three tiny humans. You want to make sure that you're having open conversations with your children and teens about this kind of thing. And if you're concerned about fentanyl, we do have fentanyl test strips. That's something that has came out that because it's so hard to detect fentanyl in a drug, you can use these test strips and it will let you know if fentanyl's in there. Of course, if you've been exposed to fentanyl, you want to use basic precautions. And then if you or someone you care about's at risk, you want to make sure that you're trained and able to give Narcan. I have, from my experience in the field, have encountered people, and you guys may have heard of this, something called a Narcan party, where addicts get together and they, or people who are using get together, actively using get together, and one will use at a time, and they will have Narcan ready. So if one of them becomes unconscious, they can Narcan the other. So that's what's kind of going on. Okay, let's see. Okay, so you're probably wondering, how does this all impact the system? So Lachey mentioned yesterday that fentanyl is, on the streets. Fentanyl has also reached our jails and prisons, unfortunately. As safe as we try to make it, fentanyl is everywhere. So these are just some regular kind of national statistics here, that 65% of the US prison population has an active substance abuse disorder. So if you hear me refer to SUD, that's what I'm referring to. So 20%, another 20% did not meet the criteria for substance abuse disorder, but they were under the influence of drugs or alcohol at the time of their crime. In 2001, also, there was 35 deaths from drug and alcohol intoxication in state prisons, and this is another national statistic. In 2018, there were 249. So there is a 611% change from 2001, as you guys can see. And these were driven by opioids, fentanyl in particular. All right, so what is East Tennessee doing? What's our health departments, what's everyone doing to try and fight this epidemic? So for those of you familiar with Judge Sloan, he has created the Tennessee Rocks program in the 4th Judicial District that he's over, called the Tennessee Recovery Oriented Compliance Strategy. So because of its success, it's actually in 14 counties across the state, and those are listed here. The program that I'm going to talk about in the next slide is Judge Sloan's 4th Judicial District Drug Recovery Court, and that's going to include Cock, Granger, Jefferson, and Sevier counties. Okay, so just a little update here, or a little background info. It was established in 2013 by Judge Sloan, and I mentioned the counties that it serves. What I think is effective, why I think his program is so effective, is because he uses this multidisciplinary team approach. Like I mentioned, Kaylee and I have sat in on these recovery court meetings, and it's basically, for those of you in the social work field, basically a treatment team meeting. So this includes, the circuit court judge, district attorney, public defender. We had a probation officer there when we were there, and then the drug court staff that are actually at the facility and dealing with these individuals in the program daily. And they're there to just kind of talk about how these individuals are progressing. I believe there's 4 phases of the program that they go through. Interestingly, I had found some data that said that a report revealed that there was a greater than 50% reduction in Tennessee Department of Corrections sentences being served locally in Jefferson County from October 2017 to October 2019. Also with this program, we have also seen a decrease in opioid overdose deaths. We've seen a decrease in babies being born with NAS, and we've also seen a decrease in crime in Granger and Jefferson counties. So I'm hoping that one day we can expand Judge Sloan's program. Like I mentioned, he has won national awards for this, so it's pretty successful. Another program that, a project that I mentioned earlier that Kaylee and I oversee, is the MOUD program in Jefferson County Jail. So this is medications used to treat people with opioid addiction. So this was a inmate patients. This is how I refer to them. Thank you, Kristen Zach. They began being treated in August of 2021. So I believe, talking to our folks in Nashville, I believe that Judge Sloan kind of started pushing this back in like 2017 or 2019. I don't have the complete exact year, but he pushed for this. And so the McNabb Center is actually the organization that oversees this project, and we just kind of do the reporting and the check-ins. And for those of you that are unfamiliar with Dr. Stephen Lloyd, who is also a wonderful human being, for those of you that have seen Dope Sick on Hulu, his character was portrayed by Dr. Sam Phoenix, and that is inspired by Dr. Stephen Lloyd. So he goes around the state of Tennessee. He talks about, he travels and he talks about how he was a doctor and struggled with opioid addiction, and how he was able to overcome that. He is giving back to the community, and he is actually the physician who takes care of these patient inmates. So he actually is the physician treating them when they're in the Fort Judicial Recovery Program, and he treats them here. A lot of the inmates, when they're released to go back into society, Dr. Stephen Wood actually continues to be their physician when they go over on the other side as well. I say the other side, go out into the community. Let's see. So how this process works, and I'm going to go into Medline too, because you guys are probably wondering what that is. So how the process works is inmates are screened at intake for substance use disorder, and if they answer yes to any questions, then they're referred to the navigator in the jail, who works with them throughout the entire process. So this navigator is similar to a social worker, similar to what our harm reduction navigators are doing in the health departments. So this information is passed on to Dr. Lloyd, who then completes a medical assessment via telehealth, and then he creates a treatment plan for them. So what I found really interesting about this program was that Dr. Lloyd sees them virtually, and they give the inmate patients tablets, and that is how he sees them. Let me see. So then the physician who's actually in the jail is the one that provides the medication from a partnering pharmacy. And then, so Medline, that is something that correctional staff and nurses are involved with. So what that is a training that was created in order to make sure inmates are taking their medication successfully. So for those of us that have worked in corrections and in jails and prisons, we know that sometimes getting them to take their medicine can be difficult. So there's some rules that are in place there, like the women have to have their hair tied up. Pills have to be crushed before being given to them. This program does exclude inmates being released in 24 hours because there's not enough time. And since the project started in August of 2021, data is still continuing to be collected. So, but so far the program's been successful as far as keeping people in treatment. The thing is, decades of research shows us that providing substance abuse treatment to criminal offenders while incarcerated is effective in reducing both drug use and crime after inmates return to the community. So treatment while in jail or prison is really critical to reducing overall crime and other drug-related burdens like lost job productivity, family disintegration, and recidivism. It's also important in reducing and preventing the spread of infectious diseases, such as HIV and hepatitis C that can be transmitted through sharing needles and other drug paraphernalia. So alternatively, inadequate treatment in jails or prisons contributes to overdoses and deaths when an inmate re-enters society. All right, so what are those barriers? Stigma. Stigma is a huge barrier. This is a huge barrier for people wanting to get treatment because addiction is still being viewed as a moral failure or flawed character. Even though medicine and science has revealed that addiction is a complex brain disorder. Many people in the criminal justice system, this is why they aren't getting treatment. And I think why non-violent drug offenses are flooding our Tennessee jails and prisons. So stigma definitely is probably a huge barrier, one of the #1 barriers that we're facing. So with that being said, I'm going to move on to the second part of what I'm going to talk to y'all about. And I know that I think we're on good time. So modernizing HIV criminalization laws in Tennessee. So I'm hoping that I can educate you all on this topic. As I always tell people, HIV is my baby, and it's something that I'm very passionate about. All right, so what do you all need to know today? So the biggest thing you need to know is that HIV transmission only happens if people engage in specific activities, and we're all adults. When I was at McNabb Center, I also was a sexual educator. So you guys are going to get a little bit of some educating today. So of course, these specific activities they include vaginal and anal sex and needle sharing. So effective methods of HIV prevention do exist. These include condoms, PrEP, which I'm sure you guys have seen on TV or heard of. That stands for pre-exposure prophylaxis. PEP, PEP, that stands for post-exposure prophylaxis. PrEP is a pill that say I'm HIV negative, my husband is HIV positive. I will take this pill every day like a birth control pill, and it will prevent me from getting HIV up to 99%. As long as my husband, who is positive, is continuing to take his antiretroviral medication and continuing to be healthy, getting that lab work done. PEP, on the other hand, is another preventative option, post-exposure prophylaxis. So that is, say, for example, you are a, someone that's a sex worker. Maybe they had sex last night and the condom broke, and they're concerned that they know that the person had HIV. You have 24 to 72 hours to go to. You can go to Choice Health Network if you're uninsured. You can go to your local emergency room and ask for PEP. And you take this every day for 28 days, and it'll prevent you from getting HIV 99%. So science has come a very long way. So also, prolonged HIV treatment is another method that exists. And then, of course, abstaining from these specific activities, which is no fun, right? So when these methods of protection are used, HIV will not spread from person to person. So the big thing to keep in mind is that PrEP is 99% successful sexually. So science has proven that if you have HIV and you have you're taking your medications daily and you have unprotected sex, you cannot pass HIV on to your partner. All right, so this is kind of HIV criminalization overview that you guys can see. So the issue is that non-disclosure is frequently an element of the crime. So the problem is that, and our disease intervention specialists here at the health department, they will actually have you sign something that says that you've been aware of your status, and that it is against the law. I believe it's against the law in 34 states here, that you cannot have sex with someone or be intimate with someone without revealing your status first. And I'm going to show you guys the TCA codes here in just a second. So effective HIV prevention strategies like PrEP, condom use, and HIV treatment are not a factor in current HIV criminalization in Tennessee. So the problem is, just like the slide showed, that this law has not been modernized. This law is still similar to back when HIV, before treatment, before PrEP, before PEP. And people living with HIV who follow CDC and TDH recommendations around condom use, disclosure to sex and drug partners, and adherence to treatment should not be criminalized. So I think this gets tricky because the law defines it as intimacy, and I will show you that here actually in a couple of slides. The law talks about intimacy, and of course intimacy can mean something different to all of us, correct? Intimacy could mean sexual intercourse. It could mean hugging. I can hug Dr. Black, or kissing someone. It means something different to each of us. So as you can see here on the slides, in most cases transmission is unnecessary, exposure without prior disclosure of status. So even if you didn't tell your partner and you used a condom, even if you didn't have the intent, which I know with criminal law, checking out intent is a huge thing. Even if you didn't have the intent, that you weren't trying to, harm this person and give them HIV, the law does not care. Just not disclosing is enough. And then, of course, like I mentioned a little bit, risk of transmission. So if you used a condom, if you have a low viral load, those things are not considered. And then, if intent to harm is rarely considered. So here's the actual Tennessee Code annotated, which is criminal exposure to HIV, hepatitis B, which is HBV, and HCV, which is hepatitis C. So you are found guilty if you know you're HIV positive and you engage in intimate, told you that word would be here, engage in intimate contact with another. So if you donate blood, tissue, any of that, share needles, you're looking at a felony. You're looking at a Class C felony, even though HIV is not a virus that can kill you anymore. If you have treatment and you're taking care of yourself, you can look at 3 to 15 years spending in prison and up to $10,000 fine. And the thing is, here in Tennessee, you also have to register as a sex offender, and that is for life. So in order to use this defense, you have to prove that the person exposed.
Santina, you got about 4 or 5 more minutes.
Perfect. Okay. So we will, I'll show you guys. Wow, I'm really impressed. I didn't think it would go the full 45. So the TCA code that you guys see here too is aggravated prostitution. A lot of people sitting in prisons are actually women who are sex workers because they didn't reveal that they were HIV positive. Same thing, you're looking at a Class C felony, 3 to 15 years, have to register as a sex offender. Let's see. Okay, so really quickly, there was a study done in Nashville, and it showed that almost half of the HIV exposure charges were for non-sexual behaviors posing little or no risk of transmission. So another interesting thing that I want to point out about this is that more than half of those arrested during this study for aggravated prostitution had offered only oral sex, which poses minimal risk of HIV transmission, very, very little risk. And nearly a third of those arrested for aggravated prostitution were homeless, struggling with substance abuse or mental impairment. So modernizing HIV criminalization laws, will likely result in positive public health outcomes. So this is going to include increased participation in HIV testing, increase voluntary HIV status disclosure, and these organizations, there's many organizations that are working to, they've proposed legislation to change the law from it in turning into a felony to turning into a misdemeanor. So that's the proposed legislation there. And then really quickly, sorry, had to quicken it up a little bit. Ways that you guys can help, or anybody can help for that nature. You guys can endorse the Positive Justice Consensus Statement on HIV criminalization. You can join or participate in the Tennessee HIV criminalization group, and just kind of being knowledgeable about it, and request an HIV criminalization presentation. So in my bio, or in my little statement that Dr. Black read, she also mentioned that I was a CDC ambassador. So on the Let's Stop HIV Together campaign, so this campaign encourages those at risk of HIV to talk about testing, condoms, pre-exposure, prophylaxis, and HIV treatment, so that they can take action to protect themselves and their partners. So I'm a 2022 ambassador. I represent Knoxville and all of East Tennessee. Therefore, I disseminate materials and education and spread awareness, usually through social media platforms. So I'll go ahead and wrap it up, Dr. Black.
Yeah, that was excellent. That was a lot of information that I appreciate. That was very well presented.
Sure.
There are a couple questions, so let me look.
A couple.
Yeah, of course I have some too. So when you were talking about the Judicial Recovery Court, how does someone get involved in that court? Are they referred to it?
Yes. So that it's basically on a case-by-case basis. So there's criteria that each person, of course, they need to be convicted of a crime, and they need to have a substance abuse disorder. Usually it just depends on, the treatment team the judges will kind of talk. That's something they did at our meeting, was they had a couple of people that they were talking about that whether they would benefit from this program or not.
Okay, and it's very similar to a lot of the problem-solving courts that have that same type of referral. Yeah.
Yes.
Let's see. Well, someone that's suffering from drug abuse, how do they find out about the programs that are offered here in this area or even in the state?
So you guys can actually go on, check those programs out at the Tennessee Department of Health's website. If you are near Jefferson County, Granger County, or in that 4th Judicial District, you can also look on their website as well. I have my email in the beginning of the slide, also in my bio. So if anybody has any questions or anything, feel free to shoot me an email and I can direct you. If I don't know, I will for sure direct you where you need to go.
Yep, that's perfect. That was going to be one of my questions here in a second. Down in the Q&A, do you have to live in the same county as navigation services to utilize those services?
Do you have to live in the same county? I'm looking at it. No, so you don't have to live in the same county so if you live in Granger County, you don't have to go to the Granger County Health Department and get services. So right now, I know this mentioned navigation services. So like I mentioned, we've got navigators in Knox, Roan, and Sevier, but we are starting to branch out. So again, if anybody has somebody that is needing help with treatment, I've got my email there for you.
Wonderful. Can fentanyl or opioids be found inside correctional facilities that you did talk about a little bit, like other drugs?
Yes. Unfortunately, yes. A little too much.
And now another question, you won't know where this comes from. How do you suggest that we overcome the stigma that you mentioned?
I would say through a lot of education and awareness. I think that's a way to beat stigma of any kind. That's what I do with my HIV campaign, because the first HIV cases were seen in 1981, and today is what, 2022, and we're still seeing stigma out here. So the best way, I think, is to just educate people. Just keep talking and getting the message out, and eventually I believe people will hear it.
Good. Let's see. One more question. Do you ever, let me check this one. Do you ever get any feedback, the agency get any feedback from giving out needles?
So Tennessee Department of Health does not give out needles. So Choice Health Network is the syringe exchange here locally that does.
Okay. Thank you.
That is just a project that we are helping to work on.
Can HIV criminalization deter researchers because they believe law enforcement could obtain confidential data to be used in the prosecution of a crime? Deter researchers?
I don't think so. You know what? I think I know who asked that. And I will have to research that a little bit more and get back with you.
But that's okay. So whoever asked that question, we have the email for Santina. So send her an email and she will follow up with that. Let's see. And if anybody else has any more questions, if you post them, we have just a few more minutes.
Ask away.
It's Friday.
Yes, I told you guys I was trying to make this
very good, very informative. I didn't know a lot of that. And as a student, I'm extremely proud to be able to say you're in the program.
Oh, thank you.
You're very welcome.
And I think a lot of people, so us criminal justice graduates, you think that we would end up, working for TDOC, working for the jails. I like to say that it's all intertwined. It all relates. This opioid crisis in our jails is a public health problem.
Well, and it's the same thing as the treatment center that I worked for with sex offenders. the two gentlemen that started that, they actually began counseling and working as clinicians with the offenders, and then they found out with the victims, and then they realized that the only way they're going to be able to stop that sex abuse is to work with the actual offenders and try to stop the recidivism. So I think this is the same goal.
Yes.
Well, thank you so much. And as you said, anybody that's interested, you can go and find her email on our presentation site. And I'm going to, at this point, turn it over to Dr. Atkins, since he is our presentation, our Zoom-A-Palooza creator.
Well,
thank you guys for having me.
Thank you so much for coming.
Thank you for being part of this, Santina, and Dr. Black for helping out. And thank you to the attendees in this session and all of the sessions that we've had. And I think this has been a real success. And I think we've learned a lot of things along the way from the presenters, and also just for us, those of us organizing this event, we've learned some things about organizing events like this. So thank you very much. And if you're watching this on recording, please leave us a comment and tell us what you thought about this event. And we will see you hopefully again next year.